The CDC has ordered enhanced Ebola screenings for any traveler who's been to Uganda in the past 3 weeks. This comes after an outbreak popped up in the country 2 weeks ago. ABC News medical contributor Dr. Alok Patel joins me live now for more on this. Dr. Patel, Ebola sparked a nationwide panic in 2014 when it spread to the U.S., but officials say that there are no confirmed or suspected cases in the U.S. right now and that the risk of Ebola here is low. So how worried should we be about this?
Well, Dan, you're absolutely correct. The risk is low right now if you're outside of Uganda. And simply put, according to the CDC, unless you are within about a foot or 3 meters of someone who is symptomatic, your risk of getting Ebola is minuscule. But as we have seen with previous infectious disease, including COVID-19, and as literally stated in the CDC directive right now, any communicable or infectious disease can go anywhere in the world within 24 hours. So it is important that we not only prevent cases from spreading across the ocean and coming from Uganda, but that we address it at its source. This is why these public health declarations and why symptomatic screening is good public health intervention.
Roughly 145 people arrive in the U.S. from Uganda every day, but only certain airports are conducting these special screenings. Why?
I think what it comes down to is what airports are most capable of handling this type of influx. And from what I briefly saw this morning, the majority of flights from Uganda are inevitably going to one of these 5 airports, as it is as well. I think one thing that we want to see play out is what exactly the questionnaire is going to look like, because there are not many, if any, direct flights from Uganda to the United States. So are we going to be honest when it comes to getting these questionnaires in place for people coming from other countries to the United States? And this is part of the complexity with screening, which is why it's very important for the public and everyone working in the healthcare profession to be aware of what's happening.
All right, before I let you go, I want to ask about COVID too. Are we going to start seeing what we've seen in the past, these surges in cases as the weather gets colder and more people stay indoors?
You know, Diane, the mere fact that I cannot give you a straight answer, or that no public health official is able to tell you this is definitively what's going to happen, is why there's still a debate about whether or not we should still be calling this a pandemic, because it is unclear what could happen, especially with so many variants right now that public health officials are monitoring. It's still important for people out there to understand that 400 to 500 people could potentially die every single day. And it's absolutely important to make sure people out there are getting their vaccines and their boosters, and they're staying vigilant.
And what's the latest guidance for people who have or think they're up to date on their vaccines? When should you be looking out to get a second or third booster?
Well, it comes down to not only your age to see what you're eligible for. That's obviously different if you are young or if you're old, but everyone out there should be paying attention to at least getting that first booster that has been available for the majority of the population. We still have a very low amount of people getting that booster, especially that population above the age of 65. And I have to keep going back to the primary vaccine series. Not everyone out there has gotten that 1 shot of Johnson & Johnson or those 2 shots from the mRNA vaccines. We only have about 30% of kids age 5 to 11 who have gotten it. So start there. Those vaccines, the first ones that came out, are still extremely effective at keeping you out of the hospital.
All right, Dr. Alok Patel, always great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.